Hey folks, Dr. Dan from DocTalk here. Thanks for joining us today on the show. Dr. Chris Blevins is going to be here. He's an equine professor at Kansas State University, and we're going to talk about castrating those colts. We'll talk about when you should do it, how we do it, and some of the complications or things you can prepare that colt for surgery.
Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com. This segment brought to you by Kansas Regenerative Medicine. Your stem cells, your health, your life.
Hey folks, welcome to DocTalk. Dr. Blevins, welcome to the show.
Thanks
For being here, folks. A familiar face on DocTalk, Dr. Chris Blevins, who is a friend. He's a colleague here at Kansas State University. He's an associate clinical professor of equine medicine here, and you head up our field services and ambulatory. You are seeing a ton of cases, man, and teaching so many students. And if you live in our area or even not, drop by and see Dr. Blevins with your horse or give us a call, because it'd be pretty hard pressed to find someone that does a much better job, and we're pretty proud of him. But with that in mind, we're going to talk about something that we have to get done on these male horses. And we talk about it a lot. We do it in calves and talk about calves and that, but castrating horses is pretty common.
Yeah, and I think that when you start talking to owners about it, they always are asking, when should we do it and why should we do it? And it's still the same thing, no matter it's a dog or a bull calf. It's change behavior, hopefully, with that, and keep the animal safe, especially horses around people or other horses, because some male horses can be a little aggressive. And then also to just maintain herd, right? So it doesn't get any bigger. So castration is part of that sometimes.
Exactly. Well, talk to me a little bit about when are you wanting to have them castrated and why?
Yeah, I think a lot of it needs to happen to the point where people need to understand how quickly a horse can sexually mature. If you don't want to have a foal out of that young male, and that can be as young as 9 months of age. So even right after they wean them, a few more months, and they could actually be producing sperm that could, fertilize a mare. So they could do it as younger than 9 months.
So when's the soonest that you would recommend a castration on a colt? Is there any medical reason to doing it earlier or later? Or?
No, there's always theories of growth plates and those things that we're worried about of the young horse. Most of them are, yearlings on average when we're castrating most of them. Once you start getting over 2 years of age, you start to have more testosterone and more muscle mass and stuff, and so some of them don't really like that aspect, but the testicles drop at birth, so they could go pretty early if they wanted to.
Yeah. But usually most people are doing it when they're a year old.
Yep. Post weaning, somewhere between that 6 months to a year old is usually where they're at.
And you kind of went through this, but the reasons why we're going to do it are.
Yeah, you want to. I think a lot of it has to do with safety. Some male horses they can be aggressive to other horses and/or for the aspects of people. They can be aggressive to people. Safety.
Pretty amazing how aggressive, but the other thing is the difference in the muscling between a gelding and a stallion are just unbelievable. And you start to think about them out there running around and taking care of them. Well, we're going to take a break. When we come back, we're going to talk with Dr. Blevins about some of the things about getting your veterinarian involved, how you're going to do the castration, different things that you need to take care of your horse when it gets castrated, and much more. You're watching DocTalk. We're glad you joined us. More after these messages.
The Kansas Wheat Innovation Center in Manhattan is rediscovering ways to get improved varieties and new genetics in the hands of farmers faster. Grower-led and checkoff-funded research initiatives are bringing about positive change. This grassroots leadership provides a strong voice in Topeka and Washington, D.C. Now is the time to partner with Kansas Wheat in moving wheat forward. Kansas Wheat Commission and Kansas Association of Wheat Growers. Farmers investing in their future and yours. Log on to rediscoverwheat.org.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
Ag Promo Source is a unique group of marketing specialists with one mission: help your ag business grow. Each affiliate has their own area of expertise, and they work together to bring you advice, products, and services. To get started, visit agpromosource.com. Ag Promo Source. Together we grow.
This segment brought to you by Santa Fe Trail Meats in Overbrook. Visit us online at sftmeats.com.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Chris Blevins, who is an assistant clinical professor here in the Department of Clinical Sciences and through our Veterinary Health Center at K-State, where he heads up our equine field services section. And you know, how do veterinarians, talk to me about the different techniques for castrating or different positions.
Yeah, I think that some owners, they actually are kind of curious, like, well, how are you going to castrate my young male horse here? And there's different options, and it all depends.
You aren't going to just stick his head in a boot, are you?
No, yeah. It takes a little bit more than that to get him castrated. But, I think a lot of it has to do with the veterinarian and what they're comfortable with and what equipment they have. You can do a standing castration on a male horse. It does include a lot of sedation and blocks and techniques, because it could be dangerous. I mean, you're in between the back legs and horses can kick.
Oh, man.
They can kill you.
Yeah.
But then the other one that probably a lot of people are familiar with is they give general anesthesia. They knock the horse down on the ground, while it's sleeping, and they'll go ahead and castrate them on the ground, and they stand back up.
And those can still be very dangerous.
They can still be very dangerous, too.
We have people that get kicked,
Yep.
think the horse is anesthetized, don't have it properly restrained.
Right.
And so, whether it's a veterinarian or a producer watching, or if you have a child around and you're out with the veterinarian and going to do one of these castrations, it's best to just stay back and let them do their job.
Yeah, there's things that we need to monitor and get everything doing, but sometimes with all this, you can't have the unexpected, so you're exactly right. Safety is of a concern to everybody around while the procedure is being done.
Yep. So how long are they generally sedated?
So usually, when they're on the ground, it's about a 30-minute kind of process that you have time for, 15 to 30 minutes, depending on what drugs are given by the veterinarian. So it's not long that they're down, and they're going to then start to stand up. But with an uncomplicated castration, it usually doesn't take that long.
Well, that brings up a good point. What are some of the things, not all procedures are 100%. Right. Even with people, we tend to forget that. We think that every time we go in to have a procedure in a hospital, it's just going to work fine, and unfortunately there are complications. What are some of the complications to castrating a horse?
That's a good point. Most castrations, no worries, but things that could happen and that we're always watching for and have the owners monitoring too, even while the veterinarian leaves, is bleeding. The horse could bleed. It could bleed out if it isn't stopped and nobody notices those things. And that could even happen after the horse stands up after the general anesthesia. And so those things you'd have to be monitoring. GI or hernias come out of the inguinal canal through the abdomen out into that open area that we had opened up. So intestine or omentum, that could stick out there. That could be bad and life-threatening. And then the other thing is just infection that we're going to, and it's probably the most common that we can try to deal with as we go, but infection is another one that we have to worry about.
Cool. Well, hemorrhage, hernia, infection are the big complications, and so you're going to be watching. Not good to find a loop of gut. But,
no.
But, folks, when you hear people on calves and they say, well, I've knife cut them, never had one bleed out. They've either not castrated very many calves or they're lying.
Right.
So it can be a complication. We're going to take a break. When we come back, we're going to talk more about castration, some of the things to do with your horse, with Dr. Chris Blevins. You're watching us here from Kansas State University. Thanks for watching.
Did you know long-range planning through the checkoff can help keep your business profitable? To successfully pass on cattle operations from one generation to the next, it's important to promote beef and keep farms and ranches profitable. Your beef checkoff helps do that.
We're Jurger's Cattle Company, cow-calf operation primarily with a small replacement heifer operation. We started our operation in 2012, but we expanded on my father-in-law's operation, who started in the 70s, and built off his expertise and his knowledge and have taken and grown it to what it is today. We span about 4 different counties in North and South Carolina, running about 1,000 acres with 350 roughly head of mama cows. My husband and I and my son and my father-in-law operate together. About 2 years ago, we decided to make the switch to become all-natural producers. And what that means is it's a certain standard of quality and life for not only the calves that become part of the food source and the meat itself, but the cows also. Beef checkoff is important for our operation in a twofold way. First is marketing, creating a customer for us. We sell directly to feedlots, but our end game is the consumer. We want to create a product for the consumer that they desire, that they want to go back to the supermarket or steakhouse and they want more beef. Everybody knows the slogan, beef is what's for dinner, but it falls even more than that in that they've raised consumer awareness in quality, which is important to us because we try to focus heavily on our genetics. That's a main component of our operation, and the checkoff has allowed us to do that by promoting a product that's important to the consumer, that it's good quality, it's safe, it's nutritious, and they're gonna want to be return customers.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Sure Crop Fertilizers was started by my father, Don Sherman, and my mother, Shirley Sherman. Family business that started in the 80s. We predominantly focus on plant nutrients and what we can do to give growers better responses with the fertilizer dollars that they do, and what we can do to make those things work better for the grower. We're based out of Seneca, Kansas. We work with growers in their soil analysis to figure out what they need, and then we can put those in a blend that gives them the best results, and so that we can deliver that direct to their farm so that they have those nutrients where they need them, when they need them, and so that they can apply them in a manner that's very efficient to them and works well on their planting systems and what they're doing. Sure Crop Fertilizers has been around for a long time. We always say we're big enough to take care of everything you need, but yet we're small enough to do it quickly. You can get a hold of us at 1-800-635-4743. Our website is surecropfertilizers.com, and you can always email me at Corey@surecropfertilizers.com, and with any questions you have, we'll be glad to answer and work with you.
Hi, I'm Kim Mandring with Hardy Insurance. I'm here to help you with all of your farm and ranch needs. When it comes to protecting your operation and your family, you need a name you can trust at a price you can afford. Call me today or visit hardyaviationins.com.
This segment brought to you by Kansas Soybean Commission. Progress powered by Kansas farmers.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson with my friend and colleague Dr. Chris Blevins, where Dr. Blevins serves here at Kansas State University as an associate clinical professor in the equine section here of the Veterinary Health Center and in the Department of Clinical Sciences. He leads our field services. Call him up, have him come out, take a look at your horse. One of the things that we were talking about in break, you don't just castrate a stud colt and then kick him back out.
Yeah, I think that's something that owners need to be cautious about, because there are still sperm in the tubules, even though you got the testicles in that now a gelding, fresh new gelding, could be even up to 30 days. So why would that be an issue? Well, you could still have a foal. And so they could still breed
for 30 days
after
30
castration. Days after castration. We need to be careful. And so managing those and knowing what you're going to do with them, where it's going to get all kinds of other things, but what are you going to do after the castration? You don't just dump it in the pasture with the rest of your fillies and mares.
Yeah, then you have a little oops.
Yeah.
But so the other thing is that, we're also talking about, so people need to prepare their horse, or there's things they need to do before they're going to bring it into your clinic, or before you come out to castrate their horse. What are some of the things you like to see done prior to?
Yeah, the most comical thing is I show up and they just point where the horse is, and they're like, "Here you go." And I was like, "Well, where's the It's not halter broke." Well, I can't perform miracles here. So it needs to be halter broke.
He's not going to volunteer for this.
No,
right?
he's not going to come to me knowing what's going to happen. So it needs to be halter broke, and really, at least leadable, and most of them are young, but that is a really crucial, because we got to get drugs into them, IV, into their jugular vein, and so to do that, they need to be broke.
And it's always the case too, when they have one for Coggins.
Yeah.
And they say, "Well, can you bleed him on the trailer? I had such a hard time getting him on the trailer. I don't want to take him off and then have to put him back on." Well, that's dangerous for us. And so having your horse trained is just huge for safety. You get your arm kicked and get your arm broken, we don't work.
Yeah.
We don't make money. We're done. And so those are things that we have to maintain our health. What else?
Yeah, so I think the other thing you have to keep in mind is we're opening up the horse to the environment. So tetanus for horses is very bad prognosis if they would get it, and they're very sensitive to that. And so tetanus toxoid boostering prior to, and making sure and consult with your veterinarian before. Does it need 2 boosters before you castrate, or has it been vaccinated prior, and so we're good with just 1 more booster? But I think tetanus is also something we need to keep in mind, and making sure that that's ready to go prior to or during that event.
Cool.
Yeah.
So get your horse broke. Make sure that we have the horse properly immunized prior to coming in.
The other thing is check to make sure they have both testicles if they're young enough, and of course safety-wise, that's also something that you make sure based on complications.
Well, let's talk a little bit. Let's take a break, and then we come back. Let's talk about some of those things like high flanker and crypt torquid and things of that nature, and what you're going to do differently if we have that.
Yep.
You're watching Doc Talk. This is Dr. Chris Blevins from the Veterinary Health Service Center right here at Kansas State University. More after these messages.
Are your cows practical or profitable? If you want them to be both, come to the Dale Banks Angus Bull Sale Saturday, November 17th near Eureka, Kansas. Selling 140 yearling and coming 2-year-olds who have spent their days on the rugged pastures of the Flint Hills. For 114 years, the Perriers have been focused on providing hard-working, balanced straight bulls for progressive cattlemen nationwide. Make plans to join us November 17th or pre-register to bid online. For more information and to view our catalog, visit www.dalebanks.com.
Tarwater Farm and Home has been family owned and operated since its beginning in 1978. What you need for farm and agriculture, lawn and garden, clothing and footwear, and so much more. You'll be surprised at what you'll find in this huge store. They have what you need and lots of it. So come take a look. You'll discover that customer service is first and foremost. Always has been with the Tarwaters. Tarwater Farm and Home, 4107 North Topeka Boulevard.
Healthy cows start with the new Hired Hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher, leaving more time to tend to other vital tasks on the farm. To learn more, visit cowsprayer.com. The new Hired Hand makes healthy cows easy.
Sandstrew, veterinarian in Western Iowa. I have a veterinary clinic and started doing stem cell therapy on dogs in August of 2014. And after the first 2 dogs, after 3 weeks, I saw such dramatic results. I said, hey, I have arthritis. I have joints, really need this help. Where can I go to get this done? I had stem cell therapy done in November of 2014 on my finger joints, my hip, and the ball of my left foot, all of which I'd had real severe problems with. Saw a pretty dramatic improvement in a short amount of time. I would certainly recommend that somebody don't wait until I'm in the position that I was in with the damage already done to my joints. I encourage veterinarians to use it for their animals, and I encourage anybody who sees this video, if you have need, get in contact with these people because this is a phenomenal place to have this done.
This segment brought to you by Kansas Farm Bureau, the voice of agriculture. To join today or more information, go to kfb.org or find us on Facebook or Twitter.
Hey folks, welcome back to Doc Talk. We're here with Dr. Chris Blevins, and we're at Kansas State University where Dr. Blevins serves as the lead of our equine field services, and he is an associate clinical professor and someone that I'm very proud to call a friend and a colleague, and to get him to take time out of his schedule, thank you.
Nope, thank you.
And so now let's talk about some of the anomalies that we see, like high flanker, cryptorchids. What are these?
Yeah, you know, I think that for the most part, whenever we're castrating horses, they have 2 testicles. And so no horse or really any animal is born with only 1 testicle. They're somewhere. And so I think that that is something that always owners need to remember. And so if they're going to palpate and feel for 2 testicles, like, yeah, it feels like, you can tell your veterinarian, or if you have to have the veterinarian check, sometimes we'll say it could be potentially a high flanker. And what is that? Well, that just means the testicle is actually in the inguinal ring. It's not in the abdomen, but it's not in the scrotum. It's like in the tract that's trying to come down out into the scrotum. And so that is technically a little bit more of a procedure to get that done, but still possible for a veterinarian even out in the field. If it's in those areas. Sometimes it takes a little fishing to try to find that surgical procedure for that veterinarian, but that still could potentially be done. Now again, if the veterinarian usually doesn't get that one, they don't usually take the other one that is already dropped because of the aspects of legalities and where and what the horse still is. So they need to get that one that's hard before they take the easy one out, usually in those deals.
Gotcha. So if you can't get the high flanker, then we just hold off and then we'll castrate it and do a more...
Potentially even do a referral, like to another procedure, or have a surgeon look at it too.
Yep.
Yeah.
And then the other one is the one that's not in the scrotum or in the tract. It's in the abdomen, the cryptorchid or the Ritzlinger?
Yes,
Ritzling?
So there's an aspect, and most of the time, most people now just call them crypts, cryptorchids. But the aspect of the testicle being in the abdomen is always a possibility, so it didn't even make it into the tract. And with those, that does take general anesthesia. They have to open up the abdomen, find it, find that aspect. And usually the testicle is a lot smaller, but it's still there. Now, even with any of those, some people will say, well, the horse is a proud cut. And what does that mean? It just means that there's testicular tissue somewhere, whether it's in the abdomen or in like a high flanker, or it's just maybe still in the scrotum somewhere, didn't get all the tissue. And usually the veterinarian can be able to tell that based on a blood test and doing some stuff based on some of those
So things. It's still like a piece of the testicle is still there and it's still functioning, and so they have some stallion capability or physical attributes.
Yes, and behavior, right? So maybe it's just they're more aggressive, and we're just checking to make sure it's not due to testosterone elevation.
Cool.
Yeah.
Well, thanks for being on the show.
Yeah.
Thanks for all you do here at K-State. We're a better university because of professors and teachers like you.
Thank you.
I appreciate it.
Thank you.
Thank you for watching Doc Talk. We're glad that you did. If you want to know more about what we do on DocTalk, you can find us on the web at www.doctalktv.com. Always work with that local veterinarian, and if you want to know more about what Dr. Chris and I do here at K-State, you can find us on the web at www.vet.ksu.edu. Thanks for watching DocTalk today. with Dr. Chris Blevins, I'm Dr. Dan Thompson, and we'll see you down the road.
Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com.